Good evening, ladies and gentlemen. Time now is 20:51 on a Friday. I am coming to you to give you some feedback. As I give you this feedback, it's with a backdrop that as we speak today, South Africa has got 1,505 confirmed cases of the coronavirus. We also have recorded 9 people that have passed on. Again, I offer my condolences to those that are infected, affected with the passing away of the 9 people that I've spoken about. Also, it's within the backdrop where our economy is suffering. This morning we woke up to the realization that our rand has breached the 19 rand per dollar mark. So our situation economically is also not very good. It makes it very difficult for South Africa to procure the services that they need to get, particularly during this pandemic. My role today is to give you some feedback with regards to what SADA is doing to assist you, our health practitioners, and I'm referring to everyone in the oral health space. I have released a communication which you should have received today, and I'm going to talk briefly about some of the issues that are there without going into the detail. So, as you know, that many of our people and many of our members and the profession at large have been sending me emails, giving me calls, saying, can you assist us? I have now either closed or I'm only doing emergencies and I cannot leave financially. What is SADA doing to assist us? We've been hard at work for the past 2.5 weeks, looking at ways that can assist you. We've been speaking to partners, we've been speaking to people that we think can assist you. And I am glad that today, as we stand here, many of you will start receiving communications directly from our partners, from people that you depend on when it comes to the fight to your finances. I'm not at liberty to talk about every one of these institutions or partners until they've made their various announcements or pronouncements. If you have not received many of those, you will get. But just to mention a few, as you would have seen, the Health Professional Council of South Africa, they have now delayed the payment of your fees up until July. That gives you a breather, and it also gives us a space to continue to engage with the HPCSA with regards to the fees, which we are not happy about. It's quite a lot of fees that you cannot afford. I think more and more, the increase that the HPCSA has levied on you definitely need to be questioned. There is no way that we can allow this to go. But we appreciate the fact that they have listened to the plight of our members and they have given us the extension. Also, you will receive, if you have not received, communication from some major insurance companies, long-term and short-term, who will be giving you some relief. We've been engaging with those, and we are again grateful that they have come to the party. By the way, you see, I'm wearing the way I'm wearing, a t-shirt, a jacket, and this, just to indicate that we are in times that are uncharted, territories that are uncharted. We have to get down and work, and we have to work together. You also would have received, and if you have not received, you will receive. DP is busy communicating with its members with regards to a relief in terms of your payments. We are also still talking to the banking institutions and other institutions to try and see how we can assist you. So please bear with us as we do this. but we definitely are making inroads, as you can see from communications that have started today and more to come in the next week or so. The second thing that I want to talk about is that during this time, particularly with insurance, please do not be taken advantage of. Particularly when it comes to insurance, there will be unscrupulous insurance companies that will come and sell you insurances that you may not actually need, or you may not study them properly only to find that they don't actually help you in time of need. Whilst I cannot make everyone go for a particular insurance company or insurance services, I would like to say to you that SADA, again, for the past year to 18 months actually, we've been working with a partner to specifically create or co-create products that are specific to our profession. We hope to launch those in the next few months. It's unfortunate that by the time we were hit by the pandemic, we had not yet launched this particular product or products. It's coming. Whatever you choose, please ensure that you are covered. I also want to talk about our letter to the Minister of the National Department of Health, whereabout we have indicated, one, that in all communication, dentists seems to be left out. We are not specifically mentioned, and this concerns us. It could be that they understand us as doctors, but sometimes it gives a little bit of confusion when we are not specifically mentioned. So we have written to the Minister to indicate our concern with this. But that's not the most important thing. Our communication to the Ministry, Dr. Zwelim Kize, is that our members, since most of us are either closed or are doing emergencies, are willing to actually be part of the fight against the pandemic. And we are therefore asking them to utilize the skills from our members, those that are available and those that are willing to partake in what needs to be done to fight the pandemic. I want to thank all of those that have called me, have emailed me, indicating their willingness to actually do this. We also have written a similar letter to the MECs of the provinces, offering our services of those members that are willing to assist during this time. We also have received, unfortunately, I have received quite a lot of concern and complaint from our ComServe dentists, our young dentists, doing their first year in practice, if I can call it that way, in a region in KZN. They've indicated to me that they are forced to do normal day-to-day dentistry. And some of them, they don't even have the necessary equipment or protective clothing to protect themselves from the virus itself. They have tried, according to them, to speak to the powers that may be, and they have been ignored. I have written to the powers that may be, and I have asked them to immediately look at this, investigate it, and take action, because this is just not acceptable. We must not let our young dentists, our ComServe dentists, be exploited. These are our future of dentistry, of oral health, and in their first year, we need to look after them because we need them to live longer and be able to help South Africa in utilizing their skills. One important thing that I also want to talk about is with regards to the telephonic consultation. We have written a lot about it. I would encourage you to actually read the communication that I have put out, our SADA right, where I've spoken about this, because I think it's a critical thing. Because many of you have also been asking me if there is such a thing. And if you do teleconsulting, can you charge for it? I just want to read maybe what I've written. so that all of you understand exactly what needs to happen. Maybe while I speak about this, I have noticed that MedScheme in their guide with regards to telephonic consultation during lockdown. So I'm speaking specifically during lockdown, because remember now most of us are at home, or most of you are at home. So we have noticed that MedScheme Viral News COVID-19 update and notes with our extreme disappointment and concern the glaring absence of information about codes for telephonic consultation by dental service practitioners. Under the present regulation and without involving undue risk, telecommunication or teleconsulting rather is the only viable way for dentists to consult a patient with a problem and to determine if it's an emergency that requires immediate treatment or the issuing of a prescription. In this light, the HPCSA has also relaxed their rules for the lockdown period. SADA is currently engaging with MedScheme to review what they have put out as the guidelines. The view of SADA in this is that during the lockdown, it is your ethical duty as a health practitioner, as a dentist, to arrange for a mechanism to promote emergency services for your patients. An important phase in this is the initial contact with your patient. So SADA recommends that the initial contact be a telephonic one or electronic to determine if the patient's condition warrants emergency treatment, which entails either seeing and treating the patient or by referral to another service provider or a government-accredited healthcare facility. We have indicated that HPCSA is permitting teleconsultations for emergencies during the period of lockdown, restricted to established patients, not for new patients. It will make new guidelines available after the lockdown with this regard. Please refer to the HPCSA guideline, and we've given you a link to that. You are, and I want to stress this, you are entitled to levy a fee for telemedicine when receiving telephonic calls from established patients concerning perceived emergencies. The question is what code to use for teleconsultation. In theory, and if you look at the SADA book, the correct code is the 8893, telephonic consultation. This is, however, a new code that was introduced in the SADA Codes 2016 and has up until now not been accepted or adopted by all funders. SADA therefore suggests that you use code 8104 for these consultations. This will inform you of these following changes. So 1, 8104, limited oral examination, used for consultation for a specific problem, not requiring full mouth examination and treatment planning. It can only be charged for a specific problem which does not form part of an original treatment plan and may not be used in conjunction with a regular appointment. Code 8104 may include the issuing of a prescription. It is important that we are talking now provisions that are being given for the lockdown period. Ladies and gentlemen, I know all of you wishes South Africa well. I know there's a lot of questions. I want to again thank all of you that have been calling me or sending me emails with your suggestions. I want to invite all other members, all other health practitioners. If you've got a query or if you've got a suggestion, this is the time that you must stand out. Give me that suggestion, email me, and let us deal with the suggestion. We are all in this together. I will keep on updating you on what is happening out there and what we are doing. I wish you well, and I pray and I hope that this pandemic is going to finish much earlier and that we don't lose a lot of life during this period. I thank you and good night.